Rachel Morrison was 43 years old and had decided to take better care of herself. It wasn't a crisis. It wasn't a diagnosis. It was the quiet, rational decision of a middle-aged woman who had read enough articles on inflammation, longevity, and preventative health to conclude that it was time to make changes. She had stopped eating refined sugar. She had started walking. She had swapped her afternoon coffee for tea. Not tea bags. Concentrated green tea and capsules green tea extract, the kind sold as a supplement in pharmacies and health food stores across America, with labels promising antioxidants, fat burning, cell protection, longevity. The kind that has pictures of fresh green leaves and words like pure, natural, and clinically tested on the packaging. Rachel had read about EGCG epigallocatechin galactane, the main polyphenol in green tea, and had found studies citing liver, cardiovascular, and anti-cancer benefits. She had started taking 2 capsules a day in March 2022. The label said each capsule contained 400 milligrams of green tea, extract standardized to 45% EGCG. In November 2022, 8 months later, Rachel went to the emergency room at Northwestern Memorial Hospital in Chicago with jaundice, yellowing of the skin and eyes, abdominal pain in the upper right quadrant, and fatigue so severe she couldn't work. Liver function tests came back with ALT at 1,847 IU per liter. The normal value is below 40. Rachel's liver had gone into drug-induced liver failure by the supplement she had chosen to protect her liver. Green tea is not dangerous. This needs to be said with the same clarity as it was necessary to say about coffee, aspirin, and statins. Infused green tea leaves or tea bags in hot water. The way green tea has been consumed by billions of people across Asia for millennia is safe, well tolerated, and has the evidence profile that supplement labels rightly cite. The problem is not green tea, the problem is the concentration. A cup of infused green tea contains between 50 and 100 milligrams of EGCG. A capsule of concentrated green tea extract like the one Rachel took contained 180 milligrams of EGCG per capsule. It is 30 milligrams per day with 2 capsules, the equivalent of between 4 and 6 cups of green tea in terms of EGCG, but delivered in a concentrated form, without the dilution, without the temperature, without the matrix of other compounds that infusion produces, and without the gradual absorption that infusion guarantees. And EGCG in high concentrations does to the liver what EGCG in low concentrations does not. It induces oxidative stress within hepatocyte-state liver cells through a paradoxical mechanism of generating reactive oxygen species that is exactly the opposite of the antioxidant effect that the label promises. At concentrations above an individual threshold, a threshold that varies genetically, and that no pre-supplementation test routinely identifies, EGCG inhibits the mitochondrial electron transport chain in hepatocytes, produces an accumulation of intracellular hydrogen peroxide, and triggers hepatocellular apoptosis, program death of liver cells, in a process that begins without symptoms and evolves silently for weeks to months before any clinical signs appear. The liver begins to die, cell by cell, silently, while Rachel took the capsules she had chosen to take care of herself. What the data from the Drug-Induced Liver Injury Network (DILIN), maintained by the U.S. National Institute of Diabetes and Digestive and Kidney Diseases, documents about the proportion of dietary supplement-induced liver injury in the total number of severe hepatotoxicity cases over the past decade will permanently change how you look at a pharmacy's supplement shelf. But the mechanism by which high-concentration EGCG transforms from an antioxidant into an intracellular oxidant is the detail that no green tea extract label communicates, and that most primary care physicians don't consider when a patient mentions they are taking natural supplements. Rachel had mentioned the supplements to her general practitioner in June 2022, 3 months after starting. The doctor had listened, had said that green tea had good evidence, had noted it in the chart, and had continued the consultation. He hadn't asked for baseline liver function tests. He hadn't informed Rachel about the risk of hepatotoxicity from concentrated extract. He hadn't distinguished between green tea infusion and green tea extract capsules, because this distinction is not in the American Primary Care Supplement Assessment Protocol. In August 2022, Rachel began to feel fatigued, which she attributed to work. In September, she noticed that her urine was darker. She attributed it to dehydration. In October, she felt mild pain on the right side of her abdomen. She attributed it to a muscle strain. In November, she woke up with yellow eyes and went to the emergency room. 6 weeks of symptoms, each individually attributable to something more common. Together, They were the picture of a liver failing due to supplement-induced hepatotoxicity. There were two paths in that Northwestern Memorial emergency room. The first was to treat the acute condition without immediately connecting the hepatotoxicity to the supplement pouch within the first few hours. The second was to have a screening system that included specific questions about supplements, concentrated extracts, and medicinal teas as part of the hepatotoxicity assessment protocol, and that connected the green tea extract to the condition before Rachel needed a week of hospitalization for the diagnosis to be confirmed. The hepatologist who treated Rachel, Dr. Sumitha Nair of Northwestern Memorial, had seen 3 cases of green tea extract hepatotoxicity in the past 2 years. It was the same Dr. Nair who had published a clinical note in Hepatology in 2021 documenting the pattern and urging the FDA to review the regulation of green tea extracts and supplements. The FDA had not responded by November 2022. Rachel waited for the diagnosis with ALT at 1847. Hepatotoxicity from green tea extract is not a rare and poorly documented event. It is a growing pattern with sufficient scientific evidence for multiple international regulatory agencies to have taken action that the United States has not yet taken. In 2018, the European Medicines Agency, EMA, published a review of 78 cases of liver damage associated with green tea extract and concluded that the evidence was sufficient to require a hepatotoxicity warning on all green tea extract supplements sold in the European Union. The warning became mandatory on European labels from 2018. In the United States, no equivalent regulation has been implemented. Green tea extract continues to be marketed as a dietary supplement under the DSHEA framework, the same Dietary Supplement Health and Education Act of 1994 that allows supplements to be sold without prior proof of safety or efficacy. The label does not need to mention liver risk. The seller does not need to inform. The primary care physician is not trained to ask. The American Drug-Induced Liver Injury Network, in an analysis published in Hepatology in 2014 by Victor Navarro and colleagues, documented that dietary supplements accounted for 20% of cases of externally induced liver injury, more than any single class of prescription medication. In a 2021 analysis published in the same journal, that proportion had risen to 32%. In less than a decade, supplements have doubled their share of cases of severe liver injury in the United States. 32% of cases of severe hepatotoxicity in the US are caused by supplements. Most of the patients involved do not mention supplements in their initial medical history because they do not consider them medications. And most doctors don't ask specifically because the protocol doesn't require it. The mechanism by which high concentrations of EGCG destroy hepatocytes is called mitochondrial toxicity through oxidative uncoupling. The mitochondria of hepatocytes, the organelles responsible for producing cellular energy, have their inner membrane disrupted by supraphysiological concentrations of EGCG. The proton gradient that the mitochondrial respiratory chain normally uses to synthesize ATP collapses. The cell can no longer produce energy. The hydrogen peroxide accumulated during the process of attempting to maintain the respiratory chain produces direct oxidative damage to mitochondrial DNA and the cytoskeleton of the hepatocyte. The cell undergoes apoptosis-programmed cell death. In moderate cases, the liver can regenerate the lost hepatocytes after the offending agent is removed. In severe cases like Rachel's, with ALT levels above 1,000, the injury process is extensive enough that regeneration is incomplete, and the liver retains residual functional damage for months to years. Rachel was hospitalized for 11 days. It took 6 months for her liver enzymes to return to normal. A year later, liver function had recovered to 87% of baseline, incomplete, documented, and monitored semi-annually. Rachel's paradox wasn't ignorance. She had done her research. She had read studies. She had found real evidence about the benefits of EGCG. The evidence exists, it's published in quality journals, and it's correctly cited by those who sell the supplements. What the studies Rachel found measured were effects at infusion doses, 550 to 100 milligrams of EGCG per cup, absorbed gradually, with the complete green tea matrix present. What she had bought delivered 180 milligrams per capsule, in concentrated form, without the matrix, without the gradual absorption, without the infusion compounds that modulate EGCG absorption. The instinct to take care of her health, to choose something natural, to take the most studied antioxidant in the world in a form that seemed like just a more efficient version of the infusion that billions of people safely drink, that instinct had created exposure to the only form of EGCG that Rachel's liver couldn't process without collapsing. The capsule wasn't a stronger version of the tea. It was a biologically different compound in terms of liver behavior. And the label stating green tea extract, did not communicate this difference because no American law requires it to. What American medicine has learned from Rachel Morrison, from the dial-in data, from Navarro's analysis in hepatology, from the EMA's European review, and from the growing pattern of hepatotoxicity from supplements in the United States, is that the distinction between supplement and drug, the distinction that the 1994 DSHA created and which remains unchanged, is costing livers to people who made informed choices based on information that was true but incomplete. What Rachel never received was the distinction that no American label is required to make. The distinction that the European Union considered important enough to make mandatory in 2018. The distinction between infused green tea, safe, beneficial ancient Neriac and concentrated green tea extract and capsules, potentially hepatotoxic in people with a genetic predisposition that no pre-purchase test identifies. A phrase on the label. The same phrase that European labels have carried since 2018, that American labels still don't carry. Rachel's liver functions at 87%. Because the phrase wasn't there. Europe warned in 2018. The American label didn't. The difference between green tea extract that produces the antioxidant benefits that studies document and green tea extract that destroys hepatocytes in series is not the brand, it's not the quality of the raw material, and it's not the intensity of the green in the packaging photo. It's the dose of EGCG per capsule and the presence or absence of a liver warning on the label. If you take or are considering taking green tea extract in capsule form, check the EGCG dose per capsule. Above 800 milligrams of EGCG per day, the toxicity data is consistent enough that multiple international regulatory agencies consider the risk significant. The EMA recommends that people with a history of liver disease do not use green tea extract at any dose. Ask your doctor for a baseline liver function test before starting any supplement with concentrated plant extract, not just green tea, but milk thistle in high doses, kava, ephedra, any concentrated extract of botanical origin, and ask for a reassessment after 3 months of use. The liver doesn't warn you when it starts to get damaged. Tests do. If you ask before you start and repeat after 3 months, you have the data to interpret what is happening. And if you like green tea for its documented benefits, drink green tea, infused. With hot water, with leaves or tea bags, the way millennia of safe human use have been built up. You will get the polyphenols. You will get the antioxidants. It won't receive the concentration that Rachel's liver couldn't process. The difference is the delivery method, not the compound. But green tea extract isn't the only widely sold botanical supplement in the United States with a documented pattern of hepatotoxicity that doesn't appear on the American label. In the next video, turmeric, the best-selling anti-inflammatory supplement in the United States in 2023, and the increasing cases of acute liver injury in users of high-dose curcumin with piperine, the compound manufacturers add to increase absorption by 2,000%, and which simultaneously multiplies the hepatic concentration of the compound by the same factor.